Hi, my name is Jennifer Borowczak. I'm a psychology major and a pre-occupational therapy major at Eastern Illinois University. Today I will be discussing eating disorders, including anorexia nervosa, bulimia nervosa, and also obesity. Anorexia nervosa can be defined as reducing one's food intake in the fear of becoming overweight even though already underweight. It is a dangerous disorder that can cause one to refuse to maintain average or normal weight depending on his or her age. Those with anorexia are often characterized as perfectionists and overachievers who appear to be in control. In reality, they suffer from low self-esteem and confidence and overly criticize themselves. They are also very concerned about pleasing others, according to Matthews. Switching to bulimia nervosa, which is a form of anorexia, it occurs when a person eats a meal and then vomits to not gain the weight. The taste of the food can be satisfying for this person, but the vomiting occurs afterwards to keep the weight off. Bulimia nervosa can be defined as individuals follow a routine of secretive, uncontrolled, or binge eating, ingesting an abnormally large amount of food within a set period, followed by behaviors to rid the body of food consumed. Also, bulimia nervosa usually involves vomiting, which is the most common form, laxative pills, diet pills, diuretics, fasting, and also extreme exercising. According to Cassell and Glees, bulimics have no self-control while binging and can eat up to 20,000 calories in one day or can eat for 1 1/4 hours nonstop. The exact cause of bulimia is unknown, but it may be due to the malfunctioning parts of the brain which are regulating mood and appetite. Obesity is another form of an eating disorder, and it is what America is redundantly known for. Over half of America have this disorder. It is linked to societal factors, but also in recent studies also to biological factors. People who are obese are at risk for heart problems, type 2 diabetes, strokes, sleep apnea, and respiratory problems, specific cancers, high blood pressure, and lipid disorders, according to Cassell and Glees. Obesity is not controlling the body weight or the normal weight pertaining to a person's body. There are treatments for eating disorders. When speaking of bulimia, pharmacologic interventions and psychotherapy are best used. For anorexia, it is the monitoring system of patients' weight once or twice a week, which is the most profound. Counseling, but inpatient treatment is probably the most successful. Obesity's treatment is calorie reduction, inclination of exercise, eating in moderation, and also behavior modification. Recovery is also important, but it's important to know that treatment and recovery are separate issues. One has to want to recover from an eating disorder just like any other illness or disease. It usually should involve more than the abandonment of starvation and stuffing. In conclusion, eating disorders are very hazardous overall and can even lead to death. Not taking care of oneself is very unhealthy, and a person is at high risk for health issues. Anorexia, again, which is the lack of appetite and food intake, bulimia, binge eating then purging, and obesity, which is excessively overweight, are all disorders that endanger the human body. Also, anorexic and bulimics are wrapped around the idea of the body image so much and the weight that they will engage in anything to accomplish the goals of being thin. Obesity is when one cannot control his or her eating habits. But fortunately, There are treatments and recovery that exist for these disorders, and hopefully everybody will abide by those.